Hi everyone, it's a pleasure to be here for the Women in Medicine Strong Women Leaders. We are very excited to have Dr. Tamis-Holland here with us. Thank you, Dr. Tamis, for joining us. Okay, so we just, because you all, like a lot of residents and a lot of fellows in the program really look up to you, so it's a pleasure to have you for our special series. So we just had a few questions for you. So we'd like to start with, what advice would you give to young women who are starting their careers?
Yeah, so I think that the advice I'd give is going to be for women, but also for young men. Mm-hmm. I think that the most important thing is, especially early on, a couple of things. People think about where they want to live,
yeah,
and where they, sort of, if they want to be in a particular place, and they kind of balance out where they're living, what program they're at. And I think what you want to do is you want to figure out what you want to do. Mm-hmm. And so, for example, if you want to do an academic career, yeah, I think you try to go with the best program you can get and not mm-hmm. worry so much about location for the first couple of years. Sure. I think back when we were first married and I was first starting my career, and I really limited my possibilities to just the New York State area because I wanted to be close to my mm-hmm. family and stuff. Yeah. And if you went away for just 2 years, say, just to get yourself started in a major academic medical center with perhaps opportunities that you wouldn't be afforded otherwise if you limited your aid place. And those are the early times. You're either with a spouse or with a significant other or on your own. Yeah. And you're not afraid to sort of be out there for 1 or 2 years. Yeah. So I would say in the early years, go out there, start a really good foundation, get a really strong program, especially if you want to do academics, and start off really strong because it'll build from there. Yeah. You can always then go back to New York City and get a job in academics if you've been somewhere else. Yeah. So don't restrict yourself to a particular location and try to get the strongest program you can get and really start your career out strong. Yeah, thank you so much. I think that's really wonderful because I feel like a lot of times you're like struggling between professional and personal life. Yes. So that's amazing. And that's why I say that, because I look back and I think, what would have been the big deal if for 3 years my husband and I don't know, went to Nebraska because maybe it was a great university or something, and really started out. And then after that, you have your foundation, you've done your clinical trials, or you've really gotten a lot of cath experience, whatever you want to do. Then you can go back to another area that's maybe more competitive, but you've got something to show for it. That's amazing. So that brings me to my next question. What would be one tip that you would give to young trainees out there to reconcile this work-life balance? Yeah, so I think it's really important because, and I would say, again, as important as it is for men and women, but I'm going to sound, this is terrible, but I do feel that sometimes it's a little different for women just because, I don't know, the way I perceive taking care of the children or whatever, or raising the children. I hope that it's not politically incorrect when I say this. But, and so I feel that the way I look at life in general for work-life balance is you have a certain number of hours in the day. I think of life as sort of like a pizza pie. And you can, in the beginning, you really don't even have your whole pie filled. Yeah. You only have half your pie. So you have plenty of room to take on new stuff. People ask you to do things, be part of this writing committee, be part of this committee, do this, and you're yes, because you want to take on every opportunity. You don't want to miss out. Yeah. But then you have to start thinking that then when you have your family and your significant other or your children, you really need to be sure you save some of that pie for your children. Because initially it's like, okay, well, I'll just stay a little later. And then, okay, well, I'll work on the weekends. Okay, well, I'll work in the evenings. And now all of a sudden you have no time for your family. And so I think it's really important to be careful not to take on too much, because the more you take on, the more it'll start to invade your personal time. And as much as you want to be successful, and especially when you're starting out, you don't want to say no to opportunities. As you start to get to the point where you're almost saturated in what you can do, you don't want to take, you want to be careful. I'm not saying if somebody says, do you want to be on the writing committee for a guideline? Yes, you're going to say yes. But if somebody says, we have this, this small group committee locally within this hospital that we'd like you to be on, perhaps you might say no. And just be careful about that. And the other thing is, I think, to raise a family, it takes a lot of support And whether you get support, I was very lucky because my husband stayed home with the children, so he took care of the children. Whether it's a nanny, whether it's a parent or a family, whether you try to do it together, but it's really important you have that support because you want to be with the children. And finally, I'm sorry if I'm bothering on too much because there's so much to say. When the children were younger, they never will be young again. And I had spent that time and I was always with them. I had 1 day a week where I worked from home, or basically had a 4-day work week. I still worked 80 hours in my 4-day work week, but when I was there for them. And on Saturdays and Sundays I was with them all the time. I didn't publish a lot. I made sure I did everything I had to do work-wise, took care of my patients, hopefully was a good physician. But I didn't publish that much. I wasn't that academically involved. And I don't have a regret in a second because I was with them for all those important moments, and we spent a lot of time together. So make sure you let time for the children.
I love that, and I agree. Like, we really need to learn this art of saying no, because very often we find ourselves that now we have a million things to take care of. That's when it kind of gets overwhelming. So I'm very glad you said that. And then that would bring me to my next question, which would be, what were some of the challenges that you faced as being a leader as a women leader in medicine? Let me put it that way.
So it's interesting because when I started out, I always felt that my colleagues, it was great, you're with your colleagues, and it really wasn't woman, man, or whatever. It was just whatever support you could get. And I never really noticed that there was a difference because we had a lot of women in cardiology, particularly very many years ago. But I think as you go higher in the ranks, you recognize, and it's very funny because you do start to realize that there are some people who are definitely very, I'm a man and I know it all. And then there are some men, leaders who are incredibly supportive, and there are some women who sort of act more subservient or whatnot. And I think for me personally, it's hard to say, but I think you learn to recognize the type, and you try to act as professional as you can with that type. I don't have that hesitancy to make sure that I'm recognized for what I can do and how I can do it. But personally, I just try not to associate with that group if that's going to be who they are. There's so many incredible professionals across the country, across the world, that you can work with. So there's no need to work with people who are not going to support you or respect you. And so for me, I was able to sort of separate that out and just make sure I work with the people who I really enjoy. I mean, academically work with them. In societies and writing papers and things like that. And then locally, I think or not locally, but when you're working clinically, I think you just need to stand your own. Make sure you sort of present your point in a very well spoken manner, so people get it, and make sure you are strong about how you feel and what you do, and don't let somebody make you feel something otherwise because they're making you feel inferior.
That's amazing. And coming to our last question would be, in your opinion, how would you define success? So
I think success it's so funny because success is different for everybody. To me, success is to have achieved what you want to achieve, and that could be being the absolute best clinician where your patients adore you and you deliver the best care, to somebody who's written 1,000 papers, right? It depends on what you want, but me personally, it's being able to have the balance of all three, having a family and my own personal life that's very valuable and very meaningful to me, and being with my sisters, being with my children, being with my husband, that to me is successful, while also being able to maintain some sort of presence in the academic medicine. I always say I'll never be when I was with the children, I would never be one of those mothers who was always head of the Parent Teachers Association and volunteered on every committee and did all these amazing things. I couldn't do that. And I will never be somebody say Roxana Moran, who's published thousands of papers. She's an amazing person. But I'm very happy about what I've done, and that's success to me, because it's a balance of everything, and that's what I would want.
Perfect. Well, thank you so much for your time. It's been a pleasure talking to you. Sorry.
I was just going to say, I want to tell you that I'm so proud of you.
Thank you so much. That means a lot
It
to
won't
me.
be recorded, but I see you in the future national stage, and I look forward to seeing your work.
Thank you so much. That really means a lot.